You keep going to your doctor over and over, and they give you more medications, more pills, and you're never really getting into the root cause of your problems. Nothing's really getting solved. And so, one of the things you might want to consider is that you might have inflammation, inflammation inside your body, and you're asking yourself, well, what's causing the inflammation? What's it caused by? And you got to remember, inflammation, wherever it's going to, it's going to attack the body. It's not going to make you feel very well wherever it is. So if it's in your gut, you're going to have gut issues, right? If you're going to have inflammation in your head, you're going to have brain issues. You get the point. So you could have hidden sources of inflammation. And there are a variety of causes of inflammation. Number one, it could be from GI issues. You could have a pathogen which creates cytokines in your body and causes you to have loss of nutrients. You could have emotional stress. You could have negative thoughts or be around negative people, and that will affect your hormones and cause you to have inflammation. And then the normal process of aging will cause inflammation. Then there's other things like metabolic acidosis or electrolyte imbalances that can cause that, as well as injured tissue, if you're insulin resistant, having issues with blood sugar issues, and chronic illness. All of these things in and of itself can cause an inflammatory state. And all the patients with chronic illnesses, I got to tell you, they all have inflammation. They have some type of obvious inflammation in their body, and sometimes it's not obvious, and they don't even know that. And that's why we run these labs. That's one of the reasons why we test our patients. We want to test them because you want to find out if you have a hidden source of inflammation, and those lab tests actually uncover those types of problems. So you could get a lab test done, you could find out that, oh my gosh, I didn't have any GI problems, I don't have any stomach complaints, but on my lab test it shows that I've got cryptosporidium. And you didn't even know that because you don't even have a digestive problem, but you've got a parasite infection with no digestive symptoms whatsoever. And your main cause of inflammation for you then could be the cryptosporidium, the parasite infection. So these processes, this inflammatory process, we see this, quite a bit all the time, and it affects your health. And so let me just tell you a little bit about some of the health effects of inflammation. You could have pain, you could have obesity, yes, you could get heavy because of it. You could have problems with ADD, ADHD, focus issues, peripheral neuropathies, diabetes, heart disease, stroke, migraines, thyroid problems, and even cancer can be caused by things like having inflammation. Okay, so guys, keep in mind that there's a lot of sources of inflammation. And the other thing I want to talk about, because I get this often, asked to me, is about gluten. What do you think about gluten? Bread and all that stuff, right? So I do want to discuss that a little bit. There is some genetic autoimmune disorders that really destroys the mucous membrane of the tissues. It damages what's called the Sig-A production in your body, and that creates in your body, your gut, to become basically very permeable in your GI tract. And a lot of those times this stuff is it's underdiagnosed. And it's really common in people that have issues with alcohol, alcohol abuse, and people that have actually food-related disorders, food sensitivity disorders. So people that are really gluten sensitive, they have a lot of tissue damage, and they have problems with Sig-A, and their immune system now starts breaking down, starts getting weaker, and because of that, then they're some more susceptible to invading pathogens and food reactions. And now they once had, they didn't have this food sensitivity to this one food. Now they've got this food sensitivity to this other food. Before they could eat maybe breads and pastas, now they can't eat it. Now they find that they can't eat strawberries and other problems because their immune system's been inflamed. Their gut's getting inflamed. They're having a decreased effect on the immune system. So now, because of that lowered immunity, they're having more problems with other types of food reactions, and their gut's getting leaky, and they didn't even know it because they got an inflammatory process going on inside of their body. And one of the culprits could have been gluten. And you really, if they're having reactions to that, basically what that is the villi inside your gut that becomes flattened. And it's like literally taking a flame torch and burning the blades of grass in your yard. That's what gluten does inside people's body. It literally inflames all that villi flattens it out. You get inflammation in there, then you start having all these other issues that come along with it. So what could I do, doc? What could I do right now? Well, number one, I would obviously suggest get tested to see what your specific problem is. But then there are some things you could do take home wise, that are going to be generally are going to be good, healthy for you. One is going to be fish oils, which are always going to be a good thing when you're given a multi-pack. Then there's another thing called curcumin. There's turmeric. There's a lot of other things that you can take to help with the inflammatory process. But the biggest thing is that one is you want to get tested. Number two, you want to avoid the things that are causing you to get inflamed. Okay, that's my story on inflammation. Take care.